Good evening, good morning, our viewers. Today we are bringing another interesting topic, which is the principles of oral hygiene. These are things that once we do them, you can avoid tooth decay or the caries or the gum disease we talked about. That includes even what? Halitosis. Meaning once you do these 5 things, you are going to avoid tooth decay at all, and you shall live a very good life without dental problems. Number 1 is what you know best. I don't know whether you know it best, but it is brushing. Brushing, everyone will tell me you know how to brush, or you have been brushing ever since you were born. But when we talk about brushing, we need to emphasize certain things. Number 1, we need to know why we brush. We brush teeth because we want to remove remaining food deposits or anything that we talked about that can cause fermentation to bring in acids. We talked about what we call carcinogenic food, or the foods that can easily be fermented to cause what? Tooth decay. So you need to make sure that after eating, you remove everything you have eaten from your mouth. Because we said, once these things are inside the mouth, or once this food is inside the mouth, the bacteria will ferment it, and after fermenting, we get acids, and the acids will burn your tooth. So you need to know that you brush after every meal. We also talked about that saliva is important, meaning the moment you brush your teeth, or rather the moment you're going to sleep, you need to brush. Why do you need to brush, especially when you're going to sleep? We said saliva is very important. The other acids that is used, the acid that is used to burn your tooth, the moment it finds your a mouth with saliva, the saliva is going to dilute it. So the problem, once you sleep, the moment you sleep, the body rests and saliva reduces. Saliva production reduces in the body. So you need to make sure you brush your teeth, because what will dilute the other acid that will burn your tooth is not there. Secondly, you need to know that the moment you are brushing, you're removing all on such a model. You need to know that they are all surfaces of teeth. These surfaces which can be seen where you're eating from, inside and in between the teeth. So when we are talking about brushing, we talk about when to brush, how to brush, using what, and how long we should take. First of all, we shall say that we brush using a toothbrush. A toothbrush is very important. A toothbrush is very important because it is used to hold toothpaste. Remember, we said toothpaste is very important. Why is it important? Why are we not using ash? Some people will use ash. Some people use sand. Is it important? Teeth can get clean, by the way, because they are abrasive. They can cause, some people use charcoal. So do you think it is important? The reason is those things can make teeth clean or whiter, but we are saying use a toothbrush and toothpaste. What do we need in toothpaste? Whatever, some people will say, I need to use Colgate, I need to use Sensodyne, I need to use which type of Whitening, all types of toothpaste. But what is important in the toothpaste is fluoride. Fluoride is very important because the moment you use fluoride, you put it on your tooth, it is going to make your tooth very strong. So it is always good to use a toothbrush and what? And toothpaste. That is what you use. How do you brush? Some people just take brushing as a by the way, and when they are brushing, they do it very fast, as if the teeth is not even theirs. You need to brush in a very humble way. How do you brush? We say the mouth has around 5 surfaces. So as you are brushing, you do gently in a circular motion and you sweep. Circular motion, you sweep. Circular motion, you sweep. Circular motion, you sweep. You do circular motion, you sweep. Circular motion, you sweep. Circular motion, you sweep. By doing that, the food surfaces, the food particles that are in between these teeth, you have removed them. You can also go in the upper jaw. Do the same. Circular motion, you sweep. Circular motion, you sweep. Circular motion, you sweep. Of course, there are some surfaces that cannot be done in such a way. When you reach in surfaces, for example, under the tongue, for them you may not do this. Then you may now need to sweep and remove all food particles which are there. But especially under the tongue is where you do sweeping. But others you can just do what? Do this. Many people do this, but they forget the tongue. The tongue is very important. The tongue has papillae. Papillae is like a towel. The tongue is like a towel. It has those rough things on it. So a towel can look to be clean when it is actually dirty. So the moment you brush your teeth, you don't forget to brush your tongue. So remember to do it gently. Most of us forget the tongue. Some of us try to do the circular motion, but they forget to sweep. Do the circular motion, you sweep. And again, don't do this. Don't be very rough. The moment you become very rough, you are going to cause what you call abrasion, or the wearing away of the tooth surface near the what? Near the gum. Sometimes you can even cause wearing away. Sometimes you can even cause wearing away of the tooth. So make sure do circular motion, sweep gently, circular motion, sweep gently, and after brush the tongue. In the places where you cannot do the circular motion, do only what? Sweeping, and your tooth can be very clean. In some people, for example, who have problems, who are handicapped, we can also think of using power brushes. Power brushes, we encourage them, but many people do it badly. When you're using a power brush, you're not supposed to do this circular motion. When you do a circular motion, when you're using a power brush, you don't have to do this. You want to just press it, it vibrates, you move to another place. Don't do the circular motion when you're using what? A power brush or an electric toothbrush. Do only what we call what? You press on it, let it vibrate, press into another surface, press another surface, like that. You need to know how to do what? How to handle that. So make sure you do that every after a meal, and especially when you're going to sleep. When you do that, you are going to do what we call good brushing. Many people say I brush, but many people do not do the proper brushing. So as you realize, that was Number one, brushing of teeth. But as you are going to number two, there is what we call flossing. You shall realize that there is some part of the tooth where we have not touched very well, and that is the interdental area, or the area in between the what? The teeth. This is done by a floss. I am so happy that these days, even in the parties, they give us dental flosses. I went on a party recently, and I saw people serving dental flosses. I was so happy. We are getting very many dentists even in the parties. Some of them are waxed like this. When you look at this, this is a dental floss. This is a dental floss. We can also have other flosses which are coiled in this form. So what we do is that we need to make sure we floss this one. If I can open it for you very well, inside it is coiled. Inside it is like a string. So what you do is that this one is the one which is very common. But of course we have these ones which are simplified. We are saying the main aim of a floss, which we can do it once, we can floss maybe once a day, is to remove food in the interdental area, or in the area between the teeth. So what you do is that this is the middle finger, and this is the middle finger. You wrap it gently in the middle finger, and this one also in the middle finger. The forefinger and the thumb, I use it to hold the floss or the string in different sides, and you move it in between the what? The teeth. How do you do it? Unfortunately, how do you do it? The moment you have it, or you have heard it, you make sure at the moment you put it in one side, you rub it around 4 to 5 times. You can rub it around 5 times. 1, 2, 3. Then also rub it 1, 2, 3. You can even do 4 times. 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. Then you go to another area, like that. So this floss is very important to remove food particles in between the tooth surfaces. We can do it once in a day. Flossing once in a day, it is important. We said when you put it in the area between the two teeth, rub 4 to 6 times in one side of the tooth. Go to the other side, rub 4 to 6 times, and move to the other part of the what? Of the tooth. I repeat, use the middle finger. Of course, maybe let me begin from when you are unpacking it. It has somewhere to cut. This one, where to cut. Just stretch it and cut it. Easy to cut. Use the middle finger and this middle finger to hold it. Use the forefinger and the thumb to grab it firmly, and rub it. You put it between these teeth. Rub from one side, 1, 2, 3, 4, 5, or 1, 2, 3 up to 4. Also the other side, and move to another interdental area or another place near the what? Near the teeth, in between the teeth. Do it once a day is enough. Brushing is removing food particles. Now we are going to what? Flossing in between the teeth. It is what? It is finished. So now, apart from that, we have another third principle. Number 1 was brushing. Number 2 was flossing. Number 3 is diet. We said diet plays a very important role in the tooth decay. We are saying diet, especially food that can easily be fermented. We called it carcinogenic food. Foods, especially carbohydrates, especially refined sugars, you should avoid them. Many times we like our children and we give to them with sweets, with biscuits. These are foods which can easily be fermented and we produce acids and quickly burn the teeth of our children or on our teeth. So make sure you avoid, you school teachers, avoid giving sodas to children. Avoid giving cakes to children. Avoid doing these carcinogenic foods to children. Snacks to what? To children. Snacking is bad because after brushing, it is good that if you eat food, you brush. If you eat another meal, you also do what? You brush. But the foods that come in between there, they are snacks, and these snacks, you don't brush after these snacks. And they end up being fermented, causing what? Causing acids, that is which burn what? Your tooth. So this snacking is bad. You need to encourage yourselves and always like foods, for example, the foods which have fiber. For example, mangoes. For example, sugar canes. These are very good. In fact, they can even do cleansing of the what? Of the mouth. Even if you have not brushed really after eating a sugar cane, a lot of the food has been what? Removed by the sugar cane. So foods to eat and foods avoid is something that we need to caution ourselves. We have another problem or another problem which can be put under diet. Things like alcoholism. We need to avoid alcoholism because, as we saw under halitosis, can be one of the causes of what? Bad breath. Number 1 was brushing. Number 2, flossing. Diet was the next one. We need to think, or we need to go to the 4th one. Another one is the use of valid products. When you see most of the things I have here, you are going to see very well, and you shall see the mark of UNBS for those that are made in this country or that are imported in this country. Once you get products where there is no a symbol of UNBS, that one is very, 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 very bad. Sometimes people give us products, but the products are expired. The products are very dangerous. The products are not good for our health. But the products which are good, be it mouthwashes, be it flosses, be it, you can call it all sorts of what, maybe toothpaste, maybe we also have sugarless gums. We have all these things. They are good for you to first check. Is it expired? No. Is it having a symbol of UNBS? Someone should not go under his mango tree in his village and bring for you something, then you start using it. You need to first check, is the symbol of UNBS? For us in Uganda here, we have UNBS. If you go in other places, maybe in the US, you are going to find the American Association has also what? Allowed it to be a valid what? Product. So you need to make sure you are using a valid product. Some people should not go and give you, say, this one heals. You just use it when you're going to sleep, or use it 3 times a day, or just use it when you're having pain and you use. Some of them can be dangerous to our bodies. Lastly is visiting a dentist. A tooth is very hard, harder than even bone, the strongest tissue we have in the body. There is no way you can wake up one day and the tooth is paining. Meaning, if at all you visit a dentist, it can be of help. We said the tooth is made up of 3 parts. We have the enamel, which is out. We have the dentine, which is a bit inside, and the most inside one is the pulp. The pulp is the one which is having blood vessels. Meaning, once you visit the dentist and the hole or tooth decay is still in the outer part or the enamel, it can be cemented. There are many types of cement. If at all it is inside, a bit inside, what we call the dentine, there the tooth is sensitive. It can also be cemented. If it has already reached the pulp, the tooth is painful. Then it is going to cost you maybe more if at all you are going to do root canal therapy and crowning. It can also cost you more if you extract it, because we talked about consequences of extraction, including getting the mouth, the shape of the body that is looking 4 times older than your age, including supraeruption, including drifting and other effects as we talked about in the previous video. So make sure you visit your dentist, so that the moment the tooth can be cemented, it is cemented. The moment it can be root canal, it can be root canal or treated, what you call endodontic treatment, to avoid loss of what? Of teeth. In case, even if you have removed the tooth, the dentist can put an artificial what? An artificial tooth. In case you find this video very important, kindly subscribe to our YouTube channel. Thank you.